Good morning and welcome to the Thursday, March 11th, COVID-19 Response Media Briefing. I'm Frangie Mays, your facilitator for this event. I'd like to welcome our panel today. From the Washington State Department of Health, we have Dr. Umair Shah, Secretary of Health, Lacey Fehrenbach, Deputy Secretary for the COVID-19 Response, Michelle Roberts, Acting Assistant Secretary for the Division of Prevention and Community Health, Dr. Scott Lindquist, Acting State Health Officer. And from the Tacoma Pierce County Health Department, we have Dr. Anthony L.T. Chen, Director of Health. To begin today's briefing, we'll open with remarks from Secretary Shah.
Thank you, Frangie. Can you hear me okay?
Loud and clear, go ahead.
Perfect. Well, I want to just start by thanking everybody for joining us again today. And, you know, I just want to underscore the importance of these briefings and why it's so critical that we continue to communicate with all of you, our media partners, so you can ultimately communicate with our community members. And really just want to say thank you for everything that you in the media are doing to help us during this very difficult time. We are continuing to make incredible progress on vaccines. We've had more than 2 million total doses this week given in the state of Washington, and that is just amazing. In fact, we've now exceeded the 2 million mark. We've also reached our goal of 45,000 doses per day for the first time last week. And I just really want to underscore that, just if you remember when we set that goal, which was a 60-day goal, this was in January, we were looking at 13,000 vaccines that were being administered on a daily basis. And now we are well over that 45,000 mark. We've also given more than 100,000 doses at our state mass vaccination sites. So these are just fantastic numbers, but we also have to remember that this is not just about the numbers for DOH and Department of Health and the state of Washington, but this is really everybody on the ground, our local health partners, community health centers, pharmacies, hospitals, clinics, our tribal nations, and many, many, many others. And so I just want to start by underscoring this incredible and immense amount of gratitude that all of us at State Public Health have for everybody in what I call #InItTogether. I am so, in that spirit, so honored today that we're joined by Dr. Anthony Chen, who has been a colleague of mine for years, and he is the Director of Health for Tacoma Pierce County Health Department. He is going to highlight some of those real efforts on the ground. And Dr. Chen, as you know, is a leader across the country and across the state. And I just want to recognize his efforts, his team's efforts. I had a chance to visit with them several weeks ago and just was amazed by not just their vaccine efforts, but also their contact tracing and epidemiologic efforts. So just thank you, Dr. Chen, for joining us today. The new mass vaccination site at Lumen Field, as you know, is going live on Saturday.
Dr. Shah,
yeah.
I'm so sorry to interrupt. This is Frangie. We're getting I'm getting a few messages that we're not getting any sound. I'm so sorry. Can we hold for just a second while we figure out what's going on?
That's not on my end, right?
No, we can hear you, Umair.
Okay. I don't think so. Give me just one moment. Apologies, everyone.
And I can take it from the top if you'd like.
Hold for just a moment. I'm going to see if I can check with a couple of people to see that we're getting sound. Apologies once again.
So Umair, taking it from the top, in music, it's counted off 1, 2, 3, 4. In theater and musicals, they counted off 5, 6, 7, 8. It's so weird. So how do you want them to count it off? 1, 2, 3, 4, or 5, 6, 7, 8?
You know, I think I like the music part. I think music, you know, we don't want it to be theatric. So music.
Right.
I think if Scott's doing the music at the same time, either counting is fine, but we got to get the dancing motions in too.
No, 1, 2, 3, 4 works better. It's just much more logical.
And I also want to recognize that I have my Washington State mug today that I'm also drinking coffee out of. So there you go. Spokane.
Anthony's the only one not drinking coffee. He's got his mask on.
All right, so this is Frangie. I'm concerned that we might need to restart the webinar. I am not sure if the setting is in Zoom or if it is happening, if it's happening elsewhere. We can hear each other for some reason, but our participants don't seem to be able to hear us, and TBW does not have audio either.
But hey, listen, ultimately they're the ones that need to be able to hear us. So
right.
Should we dial back in?
Yeah, I'm so sorry. Give me just 1 minute. I don't want to lose all of our attendees.
Yeah, we have 58 attendees right now.
Right. Let me see if I can ask TBW if they can go out and come back in.
Frangie, there was a comment in the chat about, have we shared our sound from the video option on Zoom?
Right. I was looking at our, it looks like everyone who's been speaking has been unmuted. Okay, let's do another sound check. TBW, can you let us know if you can hear us?
Hello, hello.
I just got a message from an attendee that they can hear us. I know if you're getting it too.
Okay, let me check with just a couple more people here. Sound check. 1, 2, 3. Okay, we're going to try one more thing here, looking to make sure that we have all of the Zoom settings correct. All right, we're getting messages saying that we can be heard. Okay, so what I'd like to do is I'm going to turn on the chat for all panelists so that if you are attending and you are still experiencing sound issues, we will be able to hear from you, but please be advised we cannot take questions through the chat. All right, apologies everyone. Let's get going. Dr. Shah, would you like to take it from the top?
Yeah, I was just waiting for Scott to do the countdown.
5, 6, 7, 8.
Thank you, Scott. Apologies to our media partners, and we hope that you can hear us. I hope you can now. And Frangie, just let me know. I'm more than happy to restart a third time if necessary. My name is Dr. Umair Shah, and I'm the Secretary of Health for the state of Washington. And I just want to start by thanking you. What I said previously was thanking our media partners, because we ultimately know that it's not just you all that we are speaking to, but we're really, this is an opportunity for us. So those on TVW still cannot hear. Frangie?
Correct. I am getting that message from them. I'm apologies once again. I'm not sure what settings are different this time.
You have some people that can hear and some people who cannot.
Yes, thank you for the suggestion to record. That's where it was going just now. We will record this, and then we will be able to post it on TVW afterwards.
Okay. All right, so let's take it a third time from the top. So my name is Dr. Umair Shah. I'm the Secretary of Health for the state of Washington, and apologies for those technical difficulties. I do want to start by thanking our media partners, because you ultimately are not just our partners in and of yourselves, but the fact that you're also an incredibly important voice to be able to help us get information to our community members during these very difficult times. So I just want to say thank you to you. I know it's difficult every week to continue to hear messages, but we just want to say thank you to you from the bottom of our heart. I also want to thank Washingtonians, because we have made some incredible progress on vaccines. We've had now more than 2 million total doses that have been given in the state of Washington, which is just a remarkable achievement. We've reached our goal of giving 45,000 doses per day for the first time this past week. And if you remember that when we started the thermometer that gave us a look to the goal of 60-day goal of 45,000 per day, we were at about 13,000 vaccines that were being given every single day. And so having 3 times that is just amazing. We've also given more than 100,000 doses now at our state mass vaccination sites, which is also remarkable. And I want to thank the efforts of our Guard, as well as all of our partners, and then certainly our Department of Health staff. But it is absolutely critical that this isn't just about what's happening at the state level. This is what's happening at the local level and throughout communities, local public health departments, community health centers, hospitals, clinics, pharmacies, our tribal nations. Everybody has been pitching together, and I always call this hashtag in it together. And I do want to just recognize the incredible efforts of people on the ground, like Dr. Anthony Chen, who's joining us today. He's the director, as you know, of health for Tacoma Pierce County Health Department. And he has been a fantastic champion and friend of not just public health, but a colleague of mine for years. And I just want to thank him and his team that I had a chance to visit several weeks ago, but not just doing contact tracing and epidemiology, but certainly some very creative communication strategies. And also I want to recognize their vaccine efforts. And he's going to talk about what's happening on the ground from his perspective. I also want to highlight a few other things related to vaccines. As you know, the new mass vaccination site at Lumen Field Event Center in Seattle was highlighted yesterday by the governor and the Seattle mayor and the county executive in King County. And it really, at the end of the day, is to be the largest civilian-led mass vaccination site in the country when it opens this Saturday. And I just want to recognize the importance of this, because really we're trying to do everything we can to get vaccines into the arms of Washingtonians as quickly as possible. The site, as you know, is a partnership between City of Seattle, First and Goal, and Swedish, and it will initially vaccinate 5,000 people each week and could expand to 150,000 people each week at full capacity. And again, I want to thank our partners, especially Patty Hayes and Jeff Duchin at Seattle King County for their efforts to get that off the ground with their partners and their elected officials for everything they're doing to make sure that they can vaccinate Washingtonians and, in this case, people in King County and beyond. We're making incredible progress on phase 1B1. We vaccinated almost 60% of people that are 65 years of age or older. They've gotten at least one dose. And we've gotten almost 33%, almost a third of our seniors above age 65 are fully vaccinated, which is just incredible. And we've had more than 18% of our state's population who have gotten at least one dose, and more than 10% are fully vaccinated, which actually puts us ahead of the average numbers across the country as well. This week, shifting a bit, we have adopted new CDC guidance on safe behaviors post-vaccine. And Dr. Lindquist is on. He's going to talk through some of these. But essentially, fully vaccinated people, as you know, can gather indoors in private residences with other fully vaccinated people without wearing a mask. And they can also gather indoors in private residences with unvaccinated people from other households without masks, unless someone in one of the households is at increased risk for severe illness from COVID-19. Vaccinated people should continue wearing masks in public, avoiding crowds, and taking precautions around unvaccinated people who are at high risk. Remember, we do not have enough of our population vaccinated yet. And remember, the other thing is that the CDC did not make recommendations for people to travel at this point, because we know that as you have a surge in travel, we also have had a surge in cases. So I do want to highlight that, and Dr. Lindquist will certainly be talking about this when he speaks after me. Also, CMS, the Centers for Medicare and Medicaid Services, and CDC have updated guidance for nursing home visitation. We've looked at this as well. The new guidance allows responsible indoor visits for all residents, regardless of vaccination status, except for unvaccinated residents in counties with a COVID-19 county positivity rate that's greater than 10%, and when less than 70% of residents in the facility are fully vaccinated. Residents with confirmed COVID-19, and certainly residents in quarantine. We also recognize that isolation during the pandemic has been difficult for nursing home residents, their families, and loved ones. And it's great to see these restrictions that are now being lifted. We do want to be cautious, though, because we want to make sure that our seniors, especially in nursing homes, long-term care facilities, continue to get vaccinated, and whatever precautions are necessary, especially if there's uncertainty around what's happening within that facility or within the people that are coming into that facility, we want to make sure that that is also taken into consideration. I've had several interesting visits this week to see different parts of the COVID response here in Washington. I was able to visit our Department of Health warehouse that ships out the necessary medical and testing supplies all across the state. I just can't tell you how hard the team is working behind the scenes. This is that invisible workforce that does their job every single day. And I want to just give a shout out to the Department of Health, as well as the logistics folks across the state in all communities who have been doing just a fantastic job. I also visited our state's isolation quarantine site and saw great work that was happening there. The facility is staffed 24/7, 365 days a year. There have been responders from, obviously, Department of Health, the National Guard, Department of Corrections that are supporting the site. And it's really helping people who need a safe and comfortable place to isolate or quarantine. To date, the facility has helped 113 people throughout this pandemic since it's been open in the late fall. And what I also want to just recognize is that I did have an opportunity to meet with one of the individuals who was at that facility. And he shared with me that he had concerns about getting vaccinated. And I spent a long time trying to explain to him the benefits of vaccines. And I hope I made a difference. But I do want to make sure that we're continuing to have dialogue and conversations about the importance of COVID-19 vaccines, because ultimately, if we do not vaccinate, then we're not going to be able to get through this pandemic. And I feel very strongly about that. Yesterday morning, I spoke under oath at a confirmation hearing on my way to becoming officially confirmed as Washington Secretary of Health in the Senate Healthcare Committee in the Washington Legislature that was chaired by Senator Annette Cleveland. And I just want to say thank you to her and the entire committee for their support. And certainly that vote, I believe, is going to be taking place tomorrow. I also participated this week in the U.S. Senate Help Committee that was chaired by Senator Pat Murray. And I want to just say thank you to her for her leadership. And I also want to say just the key message that I was giving is that we have to remember the chronic underinvestment in health that's happened over the decades that has really plagued us in this pandemic, and also the importance of supporting public health and all the efforts that we need to do to modernize our workforce, modernize our technologies, and support our workforce, and also do everything we can to assure that we can get through this pandemic, which includes keeping our public health measures in place as much as it's necessary in order to fight the pandemic, while we also continue to have vaccines continue to increase. Another highlight from this week was a teletown hall with State Attorney General Bob Ferguson, as well as the AARP Washington, where we had over 6,000 seniors who joined us. I want to thank them. One of the things that I learned from that was that the vast majority of seniors have either been vaccinated or are on their way to getting vaccinated or want to get vaccinated. And that was resoundingly 86% of the people in the informal poll that AARP Washington put together. And that's just an incredible testament of the work that's happening. Precautions and accelerating vaccination are especially important as we begin to see some concerning signs in recent data. I alluded to this last week when Dr. Walensky at the CDC spoke very clearly about the fact that we were seeing a plateauing across the country. We know that we've had a total of 326,404 confirmed cases in the state of Washington. And unfortunately, again, over 5,000 deaths, 5,077 deaths in the state of Washington. And we want to make sure we continue to do everything we can to prevent as many hospitalizations and cases and deaths moving forward. As of late February, continue to see hospital admissions and deaths declining. Our case counts, which were previously declining, as I mentioned, have plateaued now. And that we're seeing in Eastern Washington and increased slightly in Western Washington. And I want to particularly talk about that with Dr. Lindquist, because the cases are increasing in Western Washington amongst younger adults, those aged 20 to 39. And this, as you know, is oftentimes a early warning sign of larger surges in the general population. So we want to watch that. Case counts are still relatively high across the state, around the same level we were seeing in late October or last October. But we want to continue to see those numbers decline, and they have been, but they have been plateauing. The other piece that's really important, and then I'm going to hand the mic over to Dr. Lindquist, is that we're continuing to detect more cases of the new variants, with 99 cases of the B117, one case now of the P1 variant, which I'm going to describe in a moment, and 5 cases of the B1351 variant as of yesterday. So the 99 cases of B117 is up from the 70 cases last week. The P1 variant case is new and is a particular concern. As you know, this has been found in Brazil, and we have some evidence that the strain, not just the concern for spreading more easily and antibodies from vaccines or previous infection may be less effective against it. So we need to watch this one very, very closely. The good news is we're continuing to see sharp declines in hospital admission rates amongst people who are older, 70 and older, and that is great news. But we want to continue to make sure that that happens to stay in that positive trend. And even if transmission increases, we can certainly protect our older population with vaccine. So I want to close by saying we can continue to protect our families, our community members by doing all the things that we've talked about when preventive measures, and they are working, wearing our masks, washing our hands, watching our distance, and making sure that we're getting tested when it's appropriate. And certainly if we have symptoms, and certainly I want to continue to emphasize to community members that we want to make sure that when you are when you are eligible for a vaccine, and we want you to continue to be patient, because while we've made an incredible amount of progress, we know there's a lot more work to do. Do not hesitate, vaccinate. And with that, I just want to thank everybody again. Sorry for the technical issues at the beginning. I'm going to turn it now back over to Frangie.
Thank you, Dr. Shah. Dr. Lindquist, did you have any remarks to add?
Yeah, a couple things. I think for the public to understand, we're moving into a new era of this pandemic. While I initially thought, it's going to be this gradual phase out and the virus goes away, it's not unrolling that way. As Dr. Shah just alluded to, there's a flattening out of the curve. And so I want to talk about that epi first. And I think if you look at our COVID dashboard and you look at the epi page, we had a first wave in March, and then it came down to a baseline, and say that was a certain level. The second wave came to a baseline that was higher than the first, and that clearly seeded the third wave, which has now come down to a flattening that Dr. Shah just talked about, which is higher than the previous two baselines. So after every wave, we're having a higher baseline. This sets us up for a continued wave. So I'm very concerned about the possibility of a fourth wave, in addition to the new variants that Dr. Shah just presented to us. It's very concerning. There aren't a lot of P1 variants in the United States, and for us to find one in Washington really shows us that it's a concern. Globally, 50% of the cases are in the countries that have the ability to do genotyping. 50% of their isolates are these variants of concern. And nationwide, it's estimated that from the IDM report, that 25% of the isolates from the US are these variants. So I'm concerned. We're at a higher rate post third wave. We're starting to see these variants, including the rarer one, the P1. And I'm really concerned about where this sets us up for the future. Despite all that, we're starting to get recommendations. And I think this is going to be our future. And it's going to be hard for you in the media to keep up with all these recommendations coming out of CMS or CDC. And so I just want to be clear, as we are moving through this pandemic, there will be guidance coming from CDC on various things. And one of the most obvious things was this opening up of visitation, especially in the long-term care facilities. So, an example of this is that a fully vaccinated resident in a long-term care facility can have contact with visitors for the very first time, which means hugs and physical contact, which is really groundbreaking. And I just want to make sure that we understand that big guidance document from CMS was released this week. Of course, they are still relying on the underpinnings of control of this pandemic. So that means you still wear a mask. Visitors are encouraged, but not required to be vaccinated. So as we get through this and more people are vaccinated, I think we'll see even more changes to CMS guidance. And a reminder that this isn't just for long-term care facilities. This is for a post-acute care facility. So we hear a lot from folks that went in to have a surgery and then they had to go to a rehab facility afterwards. And that quarantine that they were required, especially if they were fully vaccinated and tested for COVID, really didn't make a lot of sense to them. And that has been relaxed also. So these are very big and promising changes as we go through the spectrum of getting back to what our new normal will be. Notice I didn't say back to our old normal. It's going to be a new normal. CDC came out with two guidance. I just want to make sure it's crystal clear. They came out with guidance to the public. So fully vaccinated persons can, for the first time, associate with a single family gathering without a mask as long as everyone's fully vaccinated. And fully vaccinated clearly means 2 doses if you're getting the Moderna or the Pfizer, a single dose of the J&J vaccine, and 2 weeks of time have elapsed since that last dose. And then, so if you're fully vaccinated, you can have your mask off with a family. First time in this pandemic in over a year, we've made that recommendation. And as Dr. Shah said, the details are really, you got to be careful about this, because as he said, if you have an underlying condition, you need to rethink the ability to do that. And the other thing that came out of this general public guidance from CDC is that if you need to quarantine, that doesn't apply to you if you have actually been vaccinated. Now, there's some caveats to that, saying, though, if you're in a congregate setting and there's someone around that has COVID, then you still have to quarantine. But that's a relaxing of the quarantine requirement for the general public. Now, everyone asks directly from that, well, what does that mean for the healthcare workers? Because the previous guidance said, if you're a healthcare worker, even if you're fully vaccinated, if you are exposed, you still need to quarantine. That has been relaxed as of this week. Fully vaccinated healthcare workers with exposure do not need to quarantine, but you still have to consider quarantining that healthcare worker if that healthcare worker has an underlying condition that would put them at high risk for COVID. And the other point that's really clarified for these healthcare workers is you still need to follow the CDC travel guidance. That vaccination has not loosened our restrictions on travel guidance from the CDC. So with that, the last thing I just want to make sure everyone's aware of, there is a system of state laws that say if you have one of these conditions, it's called notifiable conditions, that there are requirements for reporting from healthcare facilities, doctors, and labs. That gets updated, and we have not updated that in Washington State for 11 years. And as of yesterday, I am so happy to tell you that the State Board of Health, because it's a State Board of Health rule, approved the updates, the notifiable conditions. And in addition, because COVID is not one of the notifiable conditions from the initial rule, and these rules don't go in place until January of next year, we did extend the emergency rule for reporting of COVID cases that was set to expire at the end of this month. So we are now renewed the requirement for notifiable conditions for COVID-19 or SARS-CoV-2. And with that, that's a lot of updates. And I think this is going to be our future. We're going to have tons of updates every week as we progress through the end of this pandemic. So Frangie, I'll turn it back to you.
Thank you, Dr. Lindquist. Next, we'll go to Assistant Secretary Michelle Roberts.
Well, good morning, everybody. I'm Michelle Roberts, and I lead the COVID-19 vaccine planning and distribution team for the Department of Health. I want to start by giving a shout out to our PIO team for staying calm and cool and under pressure, and all of you on the call who are letting us know about the sound today. Just like COVID vaccines, it takes a community to get this work done. And it really is why I'm so incredibly proud of the work of our community, our partners, and everyone at DOH who's helped us reach this amazing, so many amazing vaccine milestones that Secretary Shah just mentioned, especially the fact that more than 2 million doses of COVID-19 vaccine have been administered in 3 months. That's really incredibly remarkable. For comparison, in our childhood vaccine program each year, we give about 3 million doses of vaccines from kids from birth through age 18. So it's really pretty phenomenal. And I'm so glad so many more people in Washington are protected now. I can't wait to see the accomplishments our state continues to make over the coming months as more and more people get their COVID-19 vaccine. Speaking of that, if you're 65 and older and have not received your vaccine yet, now is the perfect time. Eligibility is expanding later this month, so beat the crowds and get your dose this week. It's important to us that everyone is vaccinated, especially those at highest risk. If you had a tough time getting an appointment in the past, please try again. We're working with our providers to make it easier for older adults to get vaccinated by holding appointment times, updating online vaccine scheduling systems, and even making personal phone calls. Our vaccine locator tool on DOH's website is a great resource to find both open appointments. And if you don't have internet access or if you need help, give our hotline a call. The number is 1-800-525-0217. Then press the pound symbol. Someone will help you over the phone, and language assistance is available. If you have a family member or a friend or a neighbor who's 65 and older, please do me a favor and reach out to them to see if they need help making an appointment. It's important we all work together to bring an end to this pandemic. This week's new guidance from CDC is yet another reason to get your COVID-19 vaccine as soon as you can. People who are fully vaccinated now can gather inside homes with other people in small groups, as Dr. Lindquist just said, and not have to wear a mask. That means grandparents can hug their grandkids soon, spend time with their children, and begin returning to some of the activities they've enjoyed before this pandemic began. Before I wrap up, I want to give you an update on our allocation numbers. This week, the Federal Retail Pharmacy Program is getting 72,000 doses of vaccine directly from the federal government. In Washington, Safeway, Albertsons, Costco, Health Mart, Rite Aid, Kroger, and Walmart are all taking part in the federal program. These locations are prioritizing teachers, school staff, and childcare workers this month, but anyone who is eligible can still make an appointment at one of these sites. If you want to find a full list of locations, visit vaccinefinder.org. This is the federal government's website, which is different than the state's vaccine locator website. The federal page will show you which participating pharmacies near you have appointments available through the Federal Retail Pharmacy Program. On top of this, Washington's 3-week allocation forecast from the federal government continues to increase slightly. Next week, we expect to get about 325,000 doses from the federal government in our state allocation. Our providers are requesting more than 410,000 doses of vaccine each week. This is a combination of Moderna and Pfizer, and right now we do not know when we'll receive more Johnson & Johnson vaccine. Before I go, I want to say thank you. Everyone who has received a COVID-19 vaccine is truly making a difference, but both for your own health and safety and for our communities too. Vaccine is the tool we need to end this pandemic and begin returning to life in our new normal. If you are eligible and haven't gotten your vaccine, please make an appointment today. Thank you.
Thank you, Assistant Secretary Roberts. Next, we'll go to Director Anthony L.T. Chen.
Good morning, and thank you for inviting me to be with you today. Last week, Governor Inslee visited with us at one of our drive-through clinics at the Western Washington Fairgrounds in Puyallup. Along with our partners, the Pierce County Department of Emergency Management, Multicare Health System, Virginia Mason Franciscan Health, the Pierce County Medical Reserve Corps, and literally hundreds of amazing volunteers, we have been offering these drive-through clinics where we vaccinate many people in a day. You know, we're always learning and improving, and these drive-through clinics have proven to be a great way to deliver a lot of vaccine at one time. We've also improved our processes. They have now become very easy for our customers. They're getting in and out quickly. They're giving us great feedback about it. And they're really becoming a community celebration of hope and healing. And so far, we and our partners have had 22 mass vaccination drive-through or walk-in events in Pierce County and vaccinated over 25,000 people. However, this is only the most visible way we're delivering vaccine. There's so many other ways that we're doing it. And we are especially cognizant of the fact that these don't work for everyone. Not everyone drives, not everyone's mobile, not everyone is on social media or on the internet, and they may not hear about these events. Many people are not comfortable using technology to register for a spot. We have many members in our community where they don't speak English very well, or maybe they don't read. And so we have been looking at how we can increase vaccination opportunities for everyone in our community. So for people who face access challenges at drive-through events, we use a strategy that removes barriers to vaccination. We are working on approaches for those who are currently eligible in the phases who might not hear about it through the news media, a website, or social media. It is an equity-informed approach that dovetails very well with the Department of Health's priority on equitable vaccine distribution and our focus on ensuring we get vaccine to those most affected by COVID-19. In April of last year, when it became very clear to us that some members of our community are much more susceptible to getting infected by COVID-19 and then subsequently having bad outcomes and sometimes dying from COVID-19, we formed what we call the Tacoma Pierce County Equity Action Network. Again, this is part of our learning and improving. Today, the Equity Action Network is a collection of 80 community partners who ensure that we are culturally grounded in our communications engagement. They tell us things, we listen to them, they help us in so many ways to think of ways that we can do better for everyone in our community. Through our Equity Action Network, we're engaging community partners and listening to their recommendations for the best ways to reach the highest risk adults. We are working to help remove barriers to vaccination, such as technology, language, transportation, race, poverty, and geography. This equity-informed strategy is closing gaps in vaccination uptake. We know, for example, that in our earlier mass vaccination clinics, some of these racial ethnic communities were only, when you look at the breakdown of who was getting the vaccine, we were only reaching about half of the proportion of these groups. And so that was why it was so important for us to try other strategies. And obviously, since the early phases are focused on older and elderly members of our community, we know many of them have different access issues, whether it's internet savvy or just transportation and getting around. And we have worked with trusted community organizations and service providers to ensure that eligible partners and others in communities of color who have lower rates of vaccination will be able to get vaccinated. So through these equity-informed approaches, we have offered 84 small mobile clinics serving rural communities, high-risk congregate settings, and in many other settings in our communities where COVID-19 has hit the hardest. And we have vaccinated almost 1,800 people so far in these settings. In fact, I was just on a call earlier in the week with the Tacoma Ministerial Alliance, and their member churches are hosting clinics because we know that not only are there the general access issues for them, but we're also concerned about historical precedents and concerns about vaccine, and who better to talk to that community, and who better to help them get the vaccination that they need than the leaders in their faith communities. So, we've talked about all kinds of creative things. For example, with homeless people, they don't necessarily have internet. They might not have cars. Should we have just walk-in lines for them, right? And can we work with the homeless providers and the shelters? So anyway, so in general, this has added up to the fact that here in Pierce County, we have been able to deliver about 218,000 doses. And this includes just about 33,000 doses in this past week. And a reminder that while the mass vaccination clinics, again, are the most visible, there are many other options for people to get vaccine. The backbone of our vaccine delivery system here in our county is still with our healthcare providers and with our pharmacies. And then, of course, add on top of that now the mass vaccination sites, the community-led clinics, and the many other ways that we're doing this. We're also looking forward, we've been working with our schools and making sure that our 15 school districts and our 40 private schools in Pierce County will be able to have their staff vaccinated. We're looking forward to working with employers who we will be vaccinating in the next tier because it only makes sense for us to go where the people are. So we're looking forward to moving to future phases of vaccine eligibility in the weeks ahead and getting more Pierce County residents vaccinated. More people are getting hope and healing from the vaccine, which means less coping with stress and more hoping. So thank you very much for Department of Health and our many partners in this effort.
Thank you, Director Chen. This brings us to the Q&A segment of today's briefing. Due to our technical issues in the beginning, we'd like to extend our time today by 15 minutes. And so we'll be concluding at 10:45. We just want to thank our panelists for making time for the Q&A this morning. Our first question this morning comes from Jessamine with Q13.
Good morning, and thank you very much for your time. I do appreciate it, and we do at Q13 as well. Are HIV positive Washington residents eligible for the vaccine? And if not, why? And also, we're hearing that some volunteers who wouldn't qualify for the vaccine are getting doses at vaccination sites. Is there a concern about people abusing that opportunity?
Jessamine, let me just start with that, and I'll let Dr. Lindquist and Michelle talk about the those with chronic health conditions or a health condition, for example, HIV. The comment or the observation that you have is there a concern? There's always a concern about people gaming a system. We certainly want to recognize that we want Washingtonians to do what's right by continuing to recognize why we have prioritization the way that we have prioritization for populations. It's because what we're concerned about is risk. And so if somebody is not at the highest risk and they are jumping in line ahead of someone else, and they're essentially, when we have limited vaccine supply, what they're doing is they're essentially taking away from someone else. And so that is a concern for us. But at the same time, we are doing everything we can to work with our local partners, and Dr. Chen just did a fantastic job of describing the efforts that they have on the ground. And our local health officials and partners are certainly doing whatever they can to make sure that the right people are getting vaccinated. The last thing I would say about this is that ultimately we do know that people are concerned, and certainly they are being patient, but they also want to get vaccinated. And so, yes, ultimately we are going to vaccinate as many people as we can across the state who are eligible. That means above age of 16 or have no contraindication, for example. But for at the end of the day, this is such a critical piece that we want to make sure when we're in limited vaccine supply stage, which we continue to be, that we really have people respect the prioritization schedule that we have because of that reason. Now, that said, we're making incredible progress with seniors, as I mentioned, with the AARP poll, and we do think that we're going to be moving forward, soon to get to other people within the state of Washington, which includes obviously essential workers. And then let me turn it over to Dr. Lindquist and Michelle about the question regarding HIV.
Yeah, I'll say there's a lot of people with different health conditions that put them at higher risk of COVID disease. And we want to get all of those groups vaccinated as quickly as possible. We are starting to get to people with chronic conditions, especially people who have disabilities that put them at higher risk in our next group, in our tier 2. And then in our tier 3 does get to more people with underlying conditions that either put them at moderate or at high risk of increased risk for severe outcomes for COVID disease. There's a list of all those conditions on the CDC website. Immune suppression, including HIV, is one of those conditions. Right now for vaccine supply, we're in phase 3, opening up to people who have 2 or more underlying conditions, and that's just to match what we are anticipating vaccine supply will be. But obviously, we want to get as quickly as we can as vaccine supply increases to people who have even only 1 condition. So that should be coming hopefully over the next couple of months, if not sooner. But 2 conditions, 2 or more conditions, underlying conditions, it starts in April.
Yeah, I don't have a lot to add that hasn't already been said, except directly to those people with HIV or AIDS that we understand. We completely recommend this vaccine. We do feel that it is safe and effective for you. And the minute we can get it to you, we have you covered.
Thank you. Our next question comes from Ariel with the spokesman.
Great, thank you. I'm curious how the department is ensuring eligible homebound residents are getting vaccines, and also wanted to see if the department is considering streamlining appointments online for vaccines so that Washington residents can just go to one site to get an appointment in the future. Thank you.
Yeah, absolutely. As far as Homebound Seniors, we're working with one of our sister agencies, DSHS, who has information on people who are receiving services that are homebound. And we are working on identifying them. And that's where our state and local mobile teams that have been vaccinating long-term care facilities and adult family homes are going next. Some of them have already been reached because some live in, some homebound adults do live in senior living facilities as well, or independent living facilities. So that has started, and we'll be working on that over the coming weeks as well. As far as how can we improve ordering, we are working on exactly what you just suggested. So that's kind of more advanced technology. It's called API technology that would help not only show all this available appointments on our website, which we've really been able to start doing, but still right now what you have to do is click to that actual provider's website. And that is the challenge, is all these appointments live with providers and their individual scheduling system. But we're working on technology to have our kind of one-stop shopping, maybe the same way, exactly the same way you do when you go searching for hotels or for your plane ticket. You can not only find what's available, but go ahead and schedule that appointment right then and there. So we're expecting to hopefully have that work finalized within the next week or so. So much more to come. Hopefully we'll have some exciting news to share next week.
And Ariel, just to add to what Michelle said, is that this is part of what our VAC Center that's headed by Dan Laster, that he's working on with our partners at, for example, Microsoft to really enhance that technology so we can help streamline the processes and just everything what Michelle just said in addition to.
All right, thank you. Our next question comes from Ryan with the Seattle Times. Ryan, are you able to unmute?
Yep, sorry about that. Hi. So when do you think the concern about vaccine supply will kind of flip and the onus will be more on, you know, the demand and getting it out there once there is more supply in? Do you see a time going to happen soon?
Yeah, Ryan, thanks for that. And, you know, I think all of us can speculate on this one because it's hard to know exactly. It's a number of different factors. And as after I finish my comments, I would like to turn it to Dr. Chen in case he wants to talk about on the ground what his perspectives are as well. You know, when we think about vaccines, it's a three-legged stool. One leg of that is vaccine supply. One leg is the operations and logistics of just making sure that the administration is happening. And the third-legged stool, as you just mentioned, is vaccine demand. And right now that supply has been markedly low. And so, you know, whatever we're doing for logistics is exceeding what that vaccine supply is. Eventually, vaccine supply will increase, and we hope that it's done in a methodical manner. But there's also the administration will continue to match it. But then the demand right now is for every vaccine. You've got you know, people that are ready to take the vaccine. Although that's not universal, there are certain counties or communities where we're seeing or hearing that they feel like they've gotten further along. And we're at the state really looking at what that means for us from a planning standpoint. But we do think, and I said this last week, again, anecdotally, without really having any data, is that vaccine hesitancy may be something that we'll start to see sooner than later. And I last week was thinking maybe a couple weeks down the road that we would start to see that. So it's hard to know, but this is really a national phenomenon that we're starting to see where you're getting through certain populations. And then you're recognizing that we had a certain number of people that were in those populations, like health workers, and it looks like you know the appointments aren't fully going, so you're going to seniors, and then you're recognizing one of the reasons the health workers or the seniors are not getting vaccinated is because there may be some drop off by willingness to get vaccinated. So I would say this is something that public health is now recognizing, as we've recognized it throughout, but really recognizing that this is a significant challenge and something that is going to really impact us as we think about getting to that goal of adequate vaccine coverage. And I do use that term more than I use herd immunity. We just want to have adequate vaccine coverage, although many people are really talking about herd immunity across the system as well. So I hope that helps, Ryan. We're hoping that it doesn't become a significant issue, but we're preparing ourselves for doing whatever we can to fight any of the misinformation that's out there about vaccines. As I mentioned in the narrative about the gentleman that I met this week, that we are concerned that people are for misinformation or mistrust, that they may decide not to get vaccinated, and we think that that would be terrible because, again, that's our way out of this pandemic. With that, Dr. Chen, would you like to make a comment on either that or what you're seeing on the ground?
Oh, absolutely. I think, when we started doing our mass vaccination clinics, it was very frustrating for people because we would announce that it would open, say, at noon, and in 15, 20 minutes, they would sell out. And we're not seeing that anymore, which is really good. I think we're seeing more vaccine available. I've heard some similar stories from neighboring counties. In fact, if you go to our website right now, we have appointment slots available. I mean, this is very different. I hope that it's not that people are burning out and getting tired of looking, but if you go to our website, www.tpchd.org/vax to the future, so it's what's on my background here, you can get an appointment, or you can call our call center, 253-649-1412. And, it just pains me when I hear people in the community say, I had an elder from a church say, well, he drove all the way to Enumclaw. Okay, from Tacoma, Enumclaw, people shouldn't have to go that far. And we do have the supply now. And it's, again, that's for all our different clinics. And it also means that our healthcare partners are getting more supply and they should be able to schedule. So encourage people to not give up. I mean, we've got vaccine, we've got availability, and people need to get vaccinated.
Dr. Chen, just really quickly, just to maybe ask a little bit more, are you sensing that vaccine hesitancy will become more of an issue in the coming weeks, more so than we're seeing now because of vaccine limitations in supply?
Well, I think this is going to be really challenging because so in each group that we're vaccinating, there will be some percentage of people who are concerned about, the vaccine for various reasons, either for historical, issues around racism, or because they're concerned about how quickly the vaccine was developed, there are various reasons. However, I can tell you, almost every day I'm hearing from people who are in the next stages who are saying, can we get to the front of the line? And I was just on a call with the Tacoma Pierce County Chamber of Commerce, and someone, was asking, like, my company does this, and we think it's kind of essential, but we're not showing up on the essential worker list. So, and we know it takes some people time to process, right? For some people, they see this as a serious decision, whether they get vaccinated or not. So for those who need time to process, that's okay. You can still come back later and we'll vaccinate you. But if we are able to move forward at whatever time, there'll be a lot of people in the next group who really want to get vaccinated. So I'm not as concerned about that. I mean, I think, at whatever speed people need to get to, let's do it. And I think, as Dr. Lindquist said earlier, some of the pain points for us through this pandemic have been people not being able to see their family, right? People not being able to go help take care of their loved parent in the rehab or nursing home because we had all these infection control procedures in place. Now, with vaccination, people are going to be able to do that. And, these long-term care facilities, many of them now, their staff and residents are vaccinated, which means that they can allow visitors. So it's not reckless that we're changing the policies around allowing visitation there. But this is the hope that we have, right? I'm not saying that tomorrow we're going to go back to normal, but we are taking steps. And one of the major ways for us to get there is to make sure we get vaccinated and especially those who are most in need of the vaccination should get vaccinated.
Thank you.
All right, our next question comes from Ayana with KHQ.
Great, thank you guys. Since you guys took over the mass vaccination site here in Spokane, I have a question in regards to registration to get the vaccine. We've heard from several viewers here in Spokane that older viewers, that they've been kind of frustrated with the process to get it, just with it being mostly online. They said, one viewer in particular said he called and put himself on the list, but he said that, he feels like he's behind people. He said because he's not as tech savvy as other people in the area, he feels like he's falling behind. And he's in his 70s, so he just feels like these younger people, because they are more technologically inclined, are getting ahead of him on the list. What should they do? How can we best help these people?
Yeah, Ayana, thanks so much. And I was trying to pull up the number for our 800 number, so I'll get that up as well in just a moment. What I really wanted to say is that you're absolutely right. I mean, these are the concerns that we have about technology, right? Technology can be your best friend. It can also be your worst enemy at times. We know not everybody is going to be as tech savvy. So when I was on with the seniors that were facilitated by AARP Washington, I mentioned obviously visit findyourphasewad.org, but I also mentioned that if they needed assistance navigating the tool or had questions, they could call 1-800-525-0127, 1-800-525-0127. So we do want to make sure that people are able to make that phone call that need help. If they're having issues or challenges going online, we absolutely want them to make that phone call so they can talk to someone who can guide them through 1-800-525-0127. And certainly we're also working with our partners on the ground. And so, Dr. Chen's team, for example, at Tacoma Pierce, but elsewhere in Spokane Regional Health, et cetera, where, there are other folks that can really help community members navigate the systems if they're having challenges with going online, and really making sure that they're able to be not just going to a phone number, but also to help them walk through some very difficult processes for some. So we are recognizing it. Obviously, this is just an ongoing challenge. We're hopeful that those modalities will help people get to not that perception of how people are feeling. I really refer to this as the 3 E's, that there is the E of effectiveness and efficiency. There's the second E of equity, and there's the third E of experience, right? We want people to walk through the experience of getting vaccinated, not to be a challenging one for them. And we're not there fully yet, because we've made an incredible amount of strides, but we still have a lot of work to do. Michelle, did I miss anything that you wanted to add?
I'll just, the only thing I want to add is just reiterating again, this takes a community to help those seniors get access to an appointment. And so I know that's why we're asking our healthcare providers to reach out to their patients, to work, and if they don't have vaccine directly, they can work with their local health department and others to identify who are their patients who are eligible. That's why when Dr. Chen was talking about partnering with community leaders, helping us identify who are the people who need to get vaccine who may haven't had an opportunity yet, and why we're asking if you have a friend or neighbor who's over 65, reach out to them and ask if they need help. It's going to take all of us to help everybody get vaccine, especially if there's any language barriers or technology barriers. But there are appointments available. And like Dr. Shah just said, we have our phone system ready to go to help schedule appointments as well. So together, we can help all these individuals get vaccinated. And now is definitely the time for our senior community, because we are going to be adding new eligible groups of some of our critical workers, in the coming days. So, in the coming weeks. So it's really important to make sure that we're assisting anybody who's not been able to get vaccinated yet.
Yeah, and the only other thing I would add is that the state COVID-19 assistance hotline, the number that I just gave, has scheduled over 14,000 vaccinations in Washington since January 25th. So I do want to recognize that we are helping, but we know that it's still challenging. So again, just a reminder to dial 1-800-525-0127. We can put it in the chat. We also have an alternate number, 888-856-5816. This is all on our website. And we really do want to work with our partners on the ground who are also, have the ability to connect with folks.
Dr. Shah, can I just kind of give some concrete examples of what you and Michelle are talking about? So about a month ago in the city of Buckley, which is in the northeast corner of our county, we had two events. One was the public mass vaccination event. It was held at White River High School. But then there was another event that the public didn't really hear about, which was where we worked with some of the senior providers in the area and senior services providers. I mean, in a small city, they know who all the seniors are, right? And they know who are not connected. So there was a separate clinic that we ran where our partners reached out to community members. They did the registration for the seniors. They made sure there was transportation. They got these seniors to the fire station where we had EMTs vaccinating them. We also, another situation where we had a community-led clinic where, again, the publicity and the notification was entirely done by our community partners. And one of our partners, Korean Women's Association, that does a whole spectrum, everything from housing to home care services, everything. They sat down and had pre-registered like 50 people who are eligible. The moment we said, we're ready for you, boom, they gave us the 50 people's names and they got them there, right? So these are just some of the concrete examples of how we can work with our partners to make sure that people hear about it, that they get registered, and that they get there so they can be vaccinated.
Thank you. Our next question comes from Tammy at Como.
Hi, good morning, everybody. Thank you so much for your time. And Dr. Lindquist, we love that countdown. My question was, today marks 1 year since the World Health Organization declared the pandemic, and it's been a really long year. That's such an understatement. What have we learned so far, and how do we move forward?
Well, Tammy, thanks. And maybe Dr. Lindquist can do that countdown as we count down to finishing and getting past this pandemic. So we're hopeful that that's sooner than later. I'll give my perspectives, and maybe we'll turn it over to each of the folks on. And if we just do a quick short one, the first thing I would say is that I don't think any of us, because of the H1N1 experience, we were hoping that this was going to be something not so severe, and obviously that is what's occurred. It is severe, and we have lost more than 500,000 American lives. We've lost countless numbers across the globe, and certainly we have in Washington over 5,000 deaths, 5,077 deaths. And so I just think what we've learned is that this has been such a horrific pandemic. We've also learned about the chronic and underinvestment in public health, and why public health is largely invisible, and yet we have not invested in public health. And then in the midst of a pandemic, we've expected public health to stand up and be able to respond when we have not invested in that public health system. And I think that's a terrible place where we are. And then the final thing is, I hope it's an inflection point for us to be thinking about what kind of world, what kind of country, what kind of state, what kind of community do we want to live in. This is a transformational moment for all of us, and just to think about how people have been impacted, yet we are very quick as Americans to turn the page to the next headline, and we do not want that to happen. We want to make sure that we are learning from this and we are investing in those systems that can help us, because the next emergency is truly, that's the only certainty, is that there is going to be an emergency around the corner, and we have to be able to respond to it. So many perspectives. It has been several months of a whole year plus of responding. Public health and healthcare systems and people are tired, fatigued as well, emotionally and physically, and certainly community members are as well. And we do recognize that. But again, while we may be tired of this virus, it's not tired of us, and we can't let our guard down.
All right, thank you.
Yeah, I thought somebody else would have some comments, but okay, we'll go to the next question.
I can just add one thing. This is not our last pandemic, okay? And so all the lessons that Dr. Shah talked about are going to be applied to the next one. We are already receiving notification about travelers coming from Ebola outbreak regions of the world. And so this is going to be obviously in real time. Next challenge for us is already here. And not to mention, we have probably the largest outbreak in the state is a hepatitis C outbreak that we need to apply a lot of these principles that we poured into COVID that we need to pour into hepatitis C that didn't get the same media attention.
Yeah, I'll just add to that. I think, I already mentioned the importance of community, which I think this has shown us again and again about the importance of taking care of each other, about realizing how your decisions impact each other. And then also just as a society, looking at the things that have been historic wrongs or challenges that have left different groups in our society with different access to the things that help determine health, whether that's education, neighborhoods, access to healthy food, a lot of different things that we need to do that have what types of jobs people have. And those are all things that as a society that are really social determinants of health that we need to figure out what kinds of structural changes can we make to make sure people have equal access to health. And even though we're looking past the pandemic, COVID is still here. And just because we have lower disease rates and we are getting more and more people vaccinated, it doesn't make the disease itself any less severe. And there's still people who are getting sick and dying in our state. So we need to keep up the hard work and continue to address all those things we've been talking about right now.
This is Lacey Fehrenbach, Deputy Secretary of COVID Response. I want to build on Michelle's great comments there. And I think the biggest lesson learned from COVID-19 is how interconnected and interdependent we all are on each other. We've seen that in terms of how the disease spreads. We've also seen it in how communities have come together to navigate through this. And we've seen it in ways as our state has come together to navigate through this and do relatively well in a horribly deadly disease situation to save more lives. And, I guess my hope for future pandemics and also for the recovery of this one is that we keep that spirit of togetherness and, remember how interconnected we are and that we're all striving for the same goals, and we have to lift everyone in our communities up.
I just want to add to that. I so appreciate what Dr. Lindquist, Michelle, and Lacey have said. If there's one lesson from all this is that everything we were doing before in public health is so important, and public health is essential, okay? You heard me talk earlier about, why is it that Black people, American Indians, Latinos in Pierce County get COVID-19 at more than twice the rate than the white population? Why is the Pacific Islanders get it 4 times more than the white population? That reflects long-term inequities and disparities in our community. It has to do with poverty, the jobs they work, discrimination, lots of access to healthcare, lots of other things. But also, I mean, who's getting really sick and dying from COVID? People with underlying health conditions. People used to wonder, like, why do we at the health department spend so much time talking about tobacco and obesity? Well, guess what? Tobacco is the #1 cause of preventable death. Obesity is #2. And these are proving to be extremely big risk factors in COVID-19. So here at Tacoma Pierce County Health Department, and I'm sure with our colleagues, whenever we can come up from air from COVID, we are talking about why are we not doing the things we used to do? Scott's talking about hepatitis C, obesity, we're talking about that. We've been looking at the work we used to do in healthy housing. We need to go back to that because those are risk factors for COVID as well. So, the more things are new, the more they're the same. But I'm glad that at least we have this opportunity to shine a light on these things, that people were wondering, what does public health do? Why are you doing these things? Well, this is exactly why we're doing it. We've been doing it for years. We still have years of work to do on all of these issues. And I'm glad that the public is understanding why we're needing to do it.
Thank you, Dr. Chen. And I couldn't agree more. Frangie, could we just go another couple questions, if you don't mind? I know that last question was all of us responded. I just want to make sure if we could just do some quick on the next two, just so we can get a couple more questions in, if you don't mind.
We do have a couple more questions waiting to be asked. Our next question comes from Whitney with KREM.
Good morning. Thank you. I appreciate you taking that extra time. Dr. Shah, my first question is for you, just because last week I talked to you about the frustration here on the East Side about vaccine availability. People are extremely frustrated that they can't get an appointment. There are so few doses available. So my question for you is, out of almost 61,000 Johnson & Johnson doses that were allocated to Washington, how is it possible that Spokane and almost all of the entire East region didn't merit any of those doses? And what are you saying to people here who believe that the distribution of these vaccines is imbalanced in favor of the West Side?
Well, first of all, we're doing everything we can to have equity across the system, including geographic equity. So I would say that, and that may be how people naturally will perceive things if they're feeling they're not getting something that is that's going elsewhere. We're following the prioritization schema that we have, and I do want to make sure that we do think about that from the standpoint of why it's important that we continue to prioritize. I will let Michelle do a quick comment about J&J. What our strategy was with J&J was to work with those counties, especially that were behind in vaccine doses, to be able to get J&J vaccine to them. So Michelle, you may want to comment on that.
Yeah, this is really just our first shipment of J&J vaccine, and we had several counties that were behind in their proportional share, and so that's where we started. It's not enough vaccine to reach statewide, but there is going to be more coming. We really do want to get counties caught up who've been behind in their proportional share, and so that was the focus at the moment. But when we have more shipments of J&J, which we're expecting later, or definitely by the end of the month, and kind of anxiously waiting, we're on pins and needles from the federal government to see if we'll get some more before then. But that vaccine will be going across the state. So we've got a lot of vaccine going into all of our communities. It's not perfect. Especially when I shared that we have more than 100,000, or next week it's 130,000 doses more requested than what we have allocated. So it is a challenge, and there's not enough vaccine to get every week, every provider. And quite frankly, there's still a ton of providers in our state who were not able to get vaccine to each week. We have about 1,400 providers enrolled, and we're getting vaccine regularly to about 300 of them. So, or about 300 each week. So we've got a lot of room for growth and a lot of people who are waiting. So that is our goal as our allocation continues to increase, is get vaccine as far as we can and to all the providers who are ready and have the capacity to help get Washingtonians vaccinated.
All right, thank you. Dr. Shah, would you like one more question or would you like to close?
Well, if we have a quick one, I can do a quick one. We do need to wrap up at a respective time. If there's a quick one, we can do it.
We can try to take a quick one from Eilish O'Neill at KUOW. Hold on just a moment. Eilish, would you like to ask a question?
Yes, thank you. I'm wondering why restaurant workers were not included with other essential workers prioritized for the vaccine, given that, starting March 22nd or whatever, given that most employer-based outbreaks in the state have been in restaurants.
Dr. Lindquist, you want to take that one?
There we go. Trying to unmute. Yeah, no, it's a great question. Quite frankly, it's under discussion right now because I feel the same, is that if you really look at the largest outbreak numbers, they are in restaurants and bars. And so that's a very logical place to put it. But the fact comes to this is we just don't have enough vaccine to do everyone. So the allocation criteria that has been established, obviously for long-term care facility, the most vulnerable for death, all these are taking a lot of time and vaccine to fulfill those. So it's just hard to get to that. But it is such a logical, I would love to answer this with, yeah, more vaccine, that's exactly where we could put it. But we just don't have enough vaccine right now. I don't know, Michelle, if you want to add anything, or Dr. Shah.
I think you've said it. It's really these are difficult choices when you don't have enough vaccine. We're hopeful though that the vaccine supply is increasing, and we're also hopeful that we'll be able to move sooner to 1B2, and that is going to start that process of moving into the next categories of people. And we have prioritized because of risk. And age was the most significant one, and now we're going into essential workers. And so it's complex, obviously, but we're doing everything we can with the limited supply that we have.
All right, this concludes the question and answer segment of our briefing. If we didn't get to your question today, please email us at doh-pio@doh.wa.gov. Dr. Shah, would you like to make any closing remarks?
Just want to say thank you to all of you. I know we had technical issues at the beginning. We went a little bit longer. I wanted to try to field a couple of extra questions if possible, and we did. I also want to thank Dr. Chen for his continued partnership, his team, and all of our local health officials and their team members who have just been with us throughout this pandemic. I just want to say thank you to them. And finally, I just want to remind everybody that we are